My name is Alana Wood and I lead the design team here at DeepMind Health.
My name is Sarah Stanley. I'm a consultant nurse in acute care and resuscitation, and I lead the patient at risk and resuscitation team here at the Royal Free London.
My name's Dominic King. I'm the clinical lead of DeepMind Health, and my role is to make sure that patient and clinician voice is heard at all steps of the products and research that we're developing. Streams is DeepMind Health's secure mobile app that has been built with and for frontline doctors and nurses. Streams draws information from a variety of existing sources and is able to provide clinicians with breaking news style alerts of patients at risk that require urgent attention.
By putting things into the mobile, we are essentially bringing together information from multiple sources so that you can get a complete overview of a patient's medical history.
As a doctor who's worked with dozens of different types of healthcare technology, I used to get really frustrated with the fact that I could see sometimes that these technologies were very useful and helpful, but could be improved upon. But it was impossible for a normal jobbing doctor or nurse to get in touch with the team that had built these technologies and make these suggestions. And I think this is something we've tried to do very differently at DeepMind, to make ourselves accessible and to also work closely with nurses and doctors to make sure that we take on board their feedback and make the improvements that they suggest.
The main feedback that I've given to DeepMind has been around the functionality and how the order of importance of blood results comes up. So just a raw number being high isn't particularly useful, but making it in red and having an arrow that's going in one direction and then a graph that supports that makes you value that information ever more important. So in my experience, the relationship with DeepMind and Royal Free London has been fantastically collaborative. So you have perceived experts clinically and experts in the IT world, and together what you're creating, I think, is something quite magical.
Quite often in our feedback sessions with doctors and nurses, they will kind of spend the first 10 minutes in disbelief that we're even there talking to them, asking them what they could possibly need or want from this product. And then we always know that we are getting it right when we hear them say that it's almost as if we've read their mind and that it's doing exactly what they would want it to.